Hi, I'm Leah Shore with Science and Medicine Group. I'm reporting from the American Association for Cancer Research, the annual meeting in New Orleans. I'm joined by Dr. Muhammed Elhadi. He's an assistant professor in the Department of Health, Behavior, and Policy at the University of Tripoli in Libya. Thank you for joining us today, Dr. Elhadi.
We have conducted this international observation study to see the impact of COVID-19 among pediatric children, age group within cancers during the pandemics. We have started this study in 2020. We have investigated this type of cancers in low and middle income countries, also in high income countries. We found that those in low middle income countries have higher odds of mortality compared to high income countries. When we adjusted these with other confounding factors, we found that those residing in low and middle income countries have 15.6 times higher mortality compared to high income countries. We also found that those who have COVID-19 positives test have 22 times more or higher probability of mortality compared to those who are COVID-19 negatives. We also found that more than 219 patients among our study, which is about 18% of our population, have their treatment delayed or disrupted or changed due to a pandemic situation in these countries. There are many ways that pediatric patients have been affected by the pandemics. One of these are surgical delay or cancellations, which is one of the most important factors contributing to these issues, because many of these eligible patients for surgery have their surgery canceled or delayed due to the pandemic. Another thing is about chemotherapy and the oncological services, which have been disrupted and delayed due to the pandemic situations, which have profoundly affected these populations of patients and their treatment, of course, and their outcomes. One of the most important things that we have to implement or change in future, especially in low middle income countries, is to implement somehow training programs, which we are working on now. It's like clinical upgrade or it's like clinical capacity building programs, which we can use to help those doctors and surgeons residing in these countries to gain more training, to gain more information about how to dealing with these patients. This can help to reduce the mortality and complication profoundly in this population. Another thing is trying to invest more and providing maybe funds for these countries who have been affected by the pandemic by providing some ways of providing chemotherapy, which are expensive to these patients, and providing other health services needed for these countries to overcome this pandemic situation. We have a 12-month follow-up, which is being developed and working on right now, and we hope to publish it soon. Although it didn't include the vaccinations because the study was conducted before the vaccination era. However, there are another studies that we are working on, which we hope to publish soon, that contain more information about the vaccination effects on pediatric and adult patients.